So to begin, we have Patrick Belek from the Clinical Science Faculty at the Northern Ontario School of Medicine in Canada. And you'll be speaking on It's All in Your Head, a journey on both sides of the stethoscope with Kevin. So please join me in welcoming Patrick.
Hello everyone. I'm also a registered nurse working in the ICU in Sudbury, Ontario. I'd like to thank all my sponsors. I have no conflicts to declare. And we're going to be talking about brain tumors. So who here deals with brain tumor patients at least once a month? Okay, 3, 4. What about once a week? 1, 2, 3, 4, okay. And what about every day? Okay, still 4, good. Well, this presentation has something for all of you, no matter the frequency at which you take care of people with brain tumors. In 2023, 1,924 Australians were diagnosed with brain tumors. However, these account only for brain cancers, and it's difficult to find statistics for Australia for overall brain tumor diagnosis. Non-malignant brain tumors are not monitored, but we do know they are more common. There are no known causes for brain tumors. They don't discriminate based on age, sex, ethnicity, or socioeconomic background. In addition to the stats you'll see on the screen, there's 2 more I want to share. In Australia, brain and other CNS cancers are the leading cause of death in children under 10, and it kills more people under 40 than any other cancers. There are over 120 different types of brain tumors, and they can be classified by the following: origin, grade, and nature. The brain is complex, and with the ability to be present anywhere within it, brain tumors can cause a wide range of signs and symptoms. Here are the 10 most common signs and symptoms for brain tumors. Brain tumors can go unnoticed for a long time. Pediatrics and the elderly population are particularly vulnerable to delayed diagnosis, as we have a tendency to minimize symptoms. So it's often a seizure that will lead to the diagnosis. Seizures are hard to ignore. People with brain tumors don't look sick. I didn't look sick on October 9th, 2012, when I received my diagnosis of a brain tumor. I want to share part of my journey with you. Symptoms started in June of 2012, as I was graduating from high school. I explained my signs and symptoms to my family doctor, and he scheduled the CT scan. In July, I started noticing visual issues, in my left eye specifically. I also had the CT scan, which turned out to be normal. In August, I went to see my optometrist. He actively listened to me, did a thorough examination, and he couldn't find anything structurally wrong with my eye. He did mention the issue could be either vascular or neurological. I'll let you guess which one that was. To give you an idea of what my vision was like at the time, you can see that normally we'll see the words and the letters individually. In my left eye, my vision was kind of pixelated. I could see the words, but I couldn't see the individual letters. In September, I started nursing school. This beginning was nothing less than hectic. Moving away from my hometown, living in a student residence, the busy social life that kept me up whether I wanted to or not. Joining the varsity swim team, on top of dealing with the immense workload that comes with nursing school. However, my symptoms got worse. I had more frequent and intense migraines, and I was exhausted. I felt dizzy and faint when exercising as well. Most of these symptoms could have been explained by stress, the workload of nursing school, the adjustment from living on my own and being self-reliant in a chaotic environment. everything except my vision loss. We typically don't go blind from stress. In October, more and more red flags were showing up. My parents and I decided to go to the hospital. We needed answers. My vision was slowly getting worse since August. And to give you an idea, I had a significant decrease in light sensitivity and clarity in my left eye. It was so gradual that it didn't ring the alarm bells until that point. I was lucky enough to have an amazing doctor. She sat down, listened to me, and ordered an MRI. And in Canada, quite specifically, it's difficult to get an MRI, even for ICU patients within 24 hours. We don't get those in Grey's Anatomy either. Like, it takes a while to get an MRI. The next day, I had another doctor come by after my MRI. He told me, "We got the results from your MRI. You have a brain tumor. I know it's a shitty news, but I'm on the phone with two hospitals to see who's going to take care of you. Do you mind traveling?" After the kindness and the attention from the first doctor, the difference in behaviors was staggering. When delivering serious, sensitive, and life-changing news like this one, there are better approaches to be used. The very simple SPICE acronym is a great place to start. That moment, receiving this diagnosis, this shitty diagnosis, as the doctor put it, shaped the way I approach my patients and their family. That moment made me the kind of nurse I am today. Now, who says brain tumor? Says, game time, let's play, find the tumor. I guess you weren't expecting to do that at the international conference. So here's the MRI that actually diagnosed me. I'll give you a few seconds to find where the tumor is. Now, it's quite difficult to find a tumor on an MRI without contrast, so let's add some gadolinium. So with, without, with, flash chance. The answer is not there, not there, right there. Kevin was the size of a marble when I was diagnosed. Who's Kevin, you might ask? This is Kevin. Kevin is a craniopharyngioma, a grade 1 non-cancerous tumor. It's not a very common type of tumor, and it's not usually diagnosed at 18. Craniopharyngiomas usually involve the stalk of the pituitary gland. A great tip to remember where the pituitary is to think of it as the scrotum of the brain. And as such, let's not be indecent here. Thank you. Craniopharyngiomas are histologically benign, but locally aggressive. In other words, they're really, really sticky and adherent and can extend beyond the cellular space, affecting the optic chiasm, the hypothalamus, and can even wrap around the carotid arteries. This makes the complete removal very difficult, leading to a high reoccurrence rate of about 50%. The good news, however, is that the 5 to 10 year survival rate is pretty high, and I'm glad to be part of this statistic and be in front of you today. So let's explore what the pituitary does. The pituitary is the king gland of the endocrine system. It's a complex system that is essential to proper functioning. Tumors near this area can cause a wide range of symptoms. Being 6'1", my growth hormones weren't affected, and oxytocin for man is typically not essential. And if you have any doubts about it, I will confirm I do not have ovaries or uterus. When we add Kevin to the equation, we can see that he dropped all those hormones to near zero. However, my prolactin was elevated. And how elevated was it? I was asked in my first week of diagnosis if my nipples lactated. For an 18-year-old guy to hear that, it's quite a shock. Kevin also caused the following deficiencies. Hypothyroidism, slowing down my metabolism and affecting my energy levels, making me very tired. Adrenal insufficiency, affecting my body's response to stress, causing the dizziness with exercise I was experiencing. Hypogonadism, lowering my testosterone to 0, affecting my muscle mass and my libido. And the most bothersome of all hormonal deficiencies, arginine vasopressin deficiency, previously known as central diabetes insipidus. I could drink quite a bit, up to 10 liters plus a day when we measured. And all that water, all that liquid I would take in would also have to be eliminated. So I could pee up to 10 liters plus a day. Quite bothersome, and it wasn't like twice a day, it was every 15 minutes. Now, if we look at Kevin and all the possible side effects it can cause, would you describe this as non-aggressive or non-life-threatening? I think we would all agree that we don't. And that is what benign means. Low-grade tumors can compress vital cerebral structures and can cause as much disruption, complication, and disability as a high-grade tumor. All brain tumors can cause mass effect, seizures, and hemorrhage. The location of the tumor can have as much effect as the nature of the tumor. There are also serious risks associated with surgery, radiation, chemo, used to treat the benign brain tumor. The word benign to define a tumor undermines the experience and the struggles that someone with a brain tumor may face, can confuse the therapeutic approach, and create a false sense of reassurance about the prognosis and the clinical outcome. In 2021, the World Health Organization changed the term benign to non-malignant. I completely support their decision, and I encourage you to keep this in mind when discussing brain tumors. The terminology you use does matter to patients. Benign is not fine. Now, what do we do? All the hormonal deficits could have been treated with medication, effectively hiding the tumor and delaying treatment. This reinforces the importance of having a clear clinical picture of the patient and not only to focus on treating the symptoms. In my case, treating the cause was the priority. I spent the next week following my diagnosis at the hospital preparing for the plan of attack. I don't know what it's like in Australia or where you're from, but the food at the hospital I quickly realized was not as appetizing as it looks, and it already doesn't look appetizing. And a diabetic muffin, for someone who is not diabetic and 18 years old, can really bring your spirits down. Thankfully, Tim Hortons, the Canadian equivalent to Starbucks, came to the rescue more than once. After 1 week in the hospital, I was discharged and told to wait for the call to schedule the surgery. I kept up with my schoolwork remotely, and after receiving the call, we went to the hospital to be told that my surgery had been moved as my surgeon was out of the country doing surgery. He's that good. And mine had been delayed to next week, falling on Halloween. I was expecting to do more normal things in my first year university Halloween. I got a trick instead of a treat. So I went my first ever surgery on Halloween. They used the endonasal transsphenoidal approach, minimizing the side effects, being less invasive. This operation lasted about 9 hours. I got bored staying in bed and recovering like a normal person, so I tried different things to keep me entertained, like wrapping my IV around an ice bottle to see if it cooled down the fluids, which it didn't. But I also realized that it was not going to be as easy as possible. Just sitting in a chair was enough to drain the little energy I had for that day. Post-op day 1, Movember happened. Halloween, November. I couldn't grow a mustache, so I decided to reinforce the term mustache dressing. Humor had an important role in my journey with my brain tumor. I went back to school 2 weeks after my surgery. I'm a nerd and I miss my social life, and I was looking forward to finding the possibility of a sense of normalcy and the chaos that had been the past months. Motivation, or maybe denial of the impacts and the restrictions that Kevin imposed on my everyday life. Or maybe I was trying to protect my friends and my family from the reality of the struggles that we were going through. After the holidays, red flags were showing up again. And I hadn't been feeling good. I was emotionally labile, my vision was getting worse in both eyes now, and my migraines were worse than ever. We called my neurosurgeons. The next day I had an appointment with my ophthalmologist and an emergency MRI, where we discovered that the tumor was back along with a cyst. Kevin returned with a friend, Bob the Blob. So the next morning, I was heading into surgery. They used the same transphenoidal endonasal approach, and I was told immediately following that surgery, recovery went great, I felt way better, that I needed a third surgery, a week after my second. But it was canceled once again, and I went back to school trying to keep up until we got the call for my third surgery. Once we received it, back to Ottawa we went. And Ottawa is about 4 hours away from where my parents live. This time they did a typical craniotomy to access the tumor from a different angle. Their main goal was to improve and save the vision in my right eye, as the left one had already been damaged permanently. The post-recovery was more difficult. There was more pain, more discomfort, and the first visible sign I had, a brain tumor, a scary amount of swelling, and a really nice scar. But I channeled my inner Rocky Balboa and kept fighting. My return to school was quickly stopped, as I needed radiation. It was urgent. We couldn't wait a few months to plan. I needed it right now. So exactly 2 weeks after my third surgery, I went in for radiation. My first 5 treatments were on a donut-looking machine. They lasted about 5 minutes each and weren't as precise. Then I got an upgrade, the CyberKnife. Absolutely amazing machine. But with being more precise, there's also a downside, which meant it lasted 45 minutes per treatment on the table with a mask on my face, not moving. Radiation also caused the tissue surrounding the affected area to become swollen, for me pressing on my optic nerve, affecting my vision even worse. At that point, I was not able to perceive light at all in my left eye, and half of my vision on my right side was blurry. It was quite difficult to read, and navigating in a busy environment was quite difficult. But the advantage of radiation is that you can get really nice pictures. You can see here of my skull and my face in the radiation mask, along with the radiation plan where they were going to send the radiation. I was tired, and resting whenever and however quickly became a necessity. So what, you're tired? No, I was exhausted all the time. I had to budget where I'd spend my energy and where I'd recharge and when I'd recharge. When you have a brain tumor, I like to compare your brain as an old cell phone. It takes a long time to charge and it drains very quickly. When you add surgery, radiation, chemo if needed to the mix, it's like you're charging your phone with a bicycle. It's inefficient and it takes energy as you do it. But I had the support of my radiation technicians, my angels, at my side for those 7 weeks. That support, filled with empathy and encouragement, was all that I needed to help me go through the days where I felt like a zombie, or when I was in lots of pain. When the last day came around, I got to ring the end of treatment bell. Well, triangle. Kind of disappointed we didn't have a bell, but I rang the hell out of that triangle. With my mom, my dad, and my radiation team at my side, the past 2 months had been quite difficult, and I was glad it was over. I spent the next few months recovering, and then in September, I went to school. 4 years later, I completed my degree and started working on the cardiology unit. Since then, I've accomplished some pretty major milestones. Buying a house, starting my own first aid CPR business, adopting my cat, Betadine, starting in the ICU, teaching at the School of Medicine, and then sharing my story on the local, national, and international level. Today, traveling the world to present my story. And you never know what the future will hold. And I want to make it clear, it doesn't mean that you have a brain tumor, that you can't reach goals like these. But people with brain tumors may face extra hurdles and struggles and delays that won't apply to people without brain tumors. The sad reality is that for some, the hurdles might be too high to overcome with a society that's not always ready or able to accommodate you. Over the past 13 years with this tumor, 8 of those were as a nurse. I learned many things having been on both sides of the stethoscope. Let's compare the top concerns for healthcare workers, nurses, and the patients. As healthcare providers, we'll address problems in a head-to-toe fashion. We'll administer treatments, medication, dressings, intervention. We'll respond to emergencies and unexpected events. Documenting, God, we know how much we need to do that. Checking off to-do lists. And repeating this for multiple patients. On the other hand, the first thing we need to understand for patients is that we don't choose to be patients. The main concerns may be finances, parking, hotel, loss of income, travel, insurance, medication, home care, and so on. The costs add up. Managing the mountain of information we receive about the illness, the treatments, medication, the benefits, and the risks, which most of the time we learn on our own. Managing, not knowing what the future holds. When we'll leave the hospital? When will lunch arrive? When will I go back to feeling normal, if ever? Juggling friends and family. How much information to give them? Dealing with their emotions, sometimes more intense than yours, and the occasional crossing of boundaries. The impact of the illness will have on school and work. Both of these are linked to social life and financial stability. The stigma of the illness and the need for accommodations may complicate the return. And being heard in healthcare can almost be a lost cause sometimes. And this may affect the will to seek healthcare in the future, alter the perception of what healthcare is and has to offer to them. And all of those on top of dealing with the emotional, mental, physical toll of the illness itself. We don't choose to be patients. Many priorities don't align. How can we take time to actively listen to our patients when you have one that has chest pain, 2 want ice water, you have to give meds to another one, you have an IV pump beeping somewhere, and you're late on your morning documentation. It's 5 p.m. and you haven't peed, sat down, or done any of the work you should have done by that time. I found one thing that can help make a difference in the care you provide. Take the time to listen. Even better when you sit. Sitting helps decrease the power dynamics that favor the healthcare worker. It shows to your patients that you're making time for them. And I want to emphasize time of quality over quantity of time. Other things that can help: be genuine with yourself and with your patients. Don't sound robotic. If you don't mean the emotion behind what you say, don't say it. It doesn't mean we're sick that we won't realize. Find a way to be empathetic. Put yourself in your patient's shoes, especially when they behave in ways that you don't expect to. They're angry and they don't want to get out of bed in the morning. It's important for their recovery. You've explained all the benefits of early mobilization. Well, maybe it's because they didn't sleep all night from the pumps, the alarms, and the nurse coming in for vitals, blood work, or medications. And know your limits. I once asked a nurse a question. She said, "I don't know, let's check." Pulled out her phone, looked up the answer. She knew her limits and proactively found an answer. Simple but effective. Also, if you feel like you're losing yourself as a nurse, it might be time to step back and prioritize self-care. Whether it's a massage, therapy, changing employers, changing departments, you can't take care of others if you don't take care of yourself first. If you don't know what to say in an emotional situation, things like, "I really wish I knew what to say," to help relieve some of the pain, the burden you have. What you're feeling is normal. It may not be normal to you, but what they are feeling about that situation is normal to them. And the most meaningful, I believe you. You don't have to understand your patients, but believing and acknowledging their struggles while offering meaningful validation is essential. As RNs and nurses, we play a big role in our patients' experiences in healthcare. Choosing what is right instead of what is easy will make a big difference. Let's quickly talk about social support. I'm almost done, I promise. Since the end of my treatments, I dove headfirst into the brain tumor community, connecting with brain tumor warriors, patients, and caregivers from across the world, and leaning on them. And if there's one thing I learned from those fellow survivors, is that I'm grateful for Kevin in some ways. He introduced me to incredible people whom I would have never crossed paths with otherwise. He allowed me to experience the world in a different way. Without Kevin, all of these connections, adventures, lifelong friendships, and all the love and support I've experienced would have never happened. But the many positive aspects of my journey are often balanced with moments that aren't bright, positive, and filled with resilience. We went through some difficult and dark times, the kind of moments that we see as nurses, the kind of moments that where life's hourglass is broken in your hand and you're trying to hold on to time like sand going between your fingers, where you want to enjoy one last moment, where you want to process what's happening to you. There's also the battles that we fight outside the hospitals, the wars we fight within ourselves. Happiness can be found even in the darkest of times if one only remembers to turn on the light. A great quote that really resonates with me and my experiences. I often use the plural pronouns, we, went, our concerns. That's because I was blessed enough to have amazing parents, Jean and Nancy Bilek, at my side during those dark moments, my hardest battles, but also in the moments where I succeeded. Without my parents didn't only remember to turn on the light, they were my light. They reinforced how essential it is for a healthcare team to include the patient's family, whether chosen or given, in the circle of care. We've experienced firsthand the impact of good and bad nurses, the importance of social support, and how humor can make dark times a little more tolerable. Without my parents, I wouldn't be here today. And I want to leave you with this. We can't control everything in life, and managing our reactions to that lack of control is difficult. Understand that others might fight invisible battles. Choose kindness, genuine gestures. That may be exactly the thing, the support that someone needs that day to fight their war against their own versions of Kevin. And little actions have big impact. Look for opportunities to use those little actions to make someone feel special and validated. Try today at some point. Lastly, it doesn't mean that it's all in your head, that it's not real. It may just be your brain's way of revealing a stronger, more sensitive, and more resilient side of you. Thank you.
Thank you, Patrick. Thank you for those valuable and personal insights. I think it's really, the longer we work, often it's really important to remember the other side of the story. So thank you very much for that.